36-year-old female with marionette lines at rest. Can this be treated with Botox, filler, or lasers, peels? I have noticed in the last couple of years that my laugh lines have gotten worse. On a positive note, I guess that means I smile a lot. However, I feel that it has made me look a little saggy. I am open to any suggestions that you might have.
Thank you for your question. You've submitted several photos and you're asking about the marionette lines or the smile lines that are occurring at the age of 36 years that you've noticed over a couple of years, and you're wondering whether Botox or fillers or some kind of solution can help you. Well, certainly I can offer an opinion about this. I'm a board-certified cosmetic surgeon practicing in Manhattan and Long Island for 20 years. I'm also a fellowship-trained oculofacial plastic surgeon. And in the perspective and the history of the use of the drug Botox, oculoplastic and oculofacial plastic surgeons and neurologists were amongst the first doctors to use Botox. Now, to explain a little bit more about what is causing this, we have to think about what's happening and why do these lines form. Well, as we get older, there is some volume loss at many levels. And certainly the early to mid-30s is a time when these changes start to appear. And what we're looking at when we think about volume loss at this level, at the concern that you have, is a combination of loss of collagen in the skin, a loss of some fat under the skin, and there's a loss of some elasticity. You know, when you're in your teens and 20s, you could smile the same way, and the skin just kind of bounces right back. And as we get older, those lines become more etched in, and they go from being very dynamic to becoming more static and present at all times. So understanding that, what is probably a practical solution and something that we do for our patients in our practice is deciding to do some kind of filler. Now, a filler that can be used for this is something in the hyaluronic acid family, a filler such as Restylane and Juvederm. These are fillers that are made of a material that's naturally found in the skin and helps to fill out or add volume to the skin at the level of the skin. Now, this is a very important distinction because at the level of the skin is not that thick. And so what we're doing is we divide the skin into the epidermis, the dermis, and the subcutis, so the under the skin area, which has fat. What we do with dermal fillers is place fillers in the dermis. Now, the balance is, when you look at the universe or spectrum of fillers, you look at fillers that are softer and last less time, and fillers that are thicker and last longer. So a lot of times the perception is, let me get a filler that is thicker and lasts longer. But the flip side of that is that a thicker filler can also create more of an impression on the skin that makes you look like you have a filler. And that's the last thing you want. You know, already at this stage, so many actors and models, etc., who have been plumped in a way that is, well, from a general perspective, maybe undesirable, is already creating a concern amongst anyone who's considering fillers as to avoid looking like they've had something done. So my suggestion usually is to use a softer filler, and even though you may need to come in more often, at least it'll blend better with the skin. Now, we also do a combination of something called platelet-rich plasma. Now, platelet-rich plasma is derived from your own blood, and it stimulates collagen, and it stimulates what's called fibrovascular ingrowth. This has also been proven based on a wound healing study where an open wound was treated with hyaluronic acid filler alone, PRP alone, and then a combination. And the combination seemed to work better. And there's some concept of a matrix being formed with this combination. It's been my observation clinically that people get more long-term benefit when there's a synergy. Basically, we're using your body's own natural healing ability to build collagen. At the same time, we're using the hyaluronic acid to provide what's called a scaffold. So that would be a typical approach in my practice to help someone like yourself. In your mid-30s, this is kind of a natural thing to do. It is very common, and it certainly is worth considering. And again, understanding that you're looking for improvement, you're not looking for erasure. It is very difficult to completely erase a wrinkle. But if we soften it and you create a better balance on over your face, or the appearance of your face, then it looks better, and it becomes less of a focal point when you look in the mirror. So I hope that was helpful. I wish you the best of luck, and thank you for your question.